we will do our best to answer them. I am backed up today by many members of our newsroom, all of whom are working from home, as we have been for a couple of weeks now. Most of us are based in New York City, the ground zero of the global coronavirus pandemic, and we are going to do our best without the aid of our usual studio equipment to bring this to you. If there are any technical difficulties, which sometimes there are, I apologize in advance and appreciate your patience. Now, if you weren't tuning into yesterday's briefing, it was an interesting one. One of the more startling moments was when President Trump was asked about the models that show that as many as 100,000 to 240,000 Americans may be killed by this disease. And he took advantage of the moment to make a joke about how he used to date models, saying that that's a different type of model than these models that predict American deaths. So that was, for me, a little bit of a jaw-dropping moment, but that was just one of many things that happened in yesterday's briefing. Substantively, one of the most important things to come out of the briefing was that the president laid out new guidelines suggesting that all Americans everywhere should wear a mask when they leave their homes. He also said that he himself would not do that. He also reiterated that it is crucial for Americans to maintain social distancing and to always try to stay at least 6 feet apart from other people. He said this while standing less than a foot away from members of his own task force. And he also reiterated the importance of avoiding large groups and said that no one should meet in groups larger than 10. Earlier that day, he invited 7 oil executives to meet with more than 3 members of his administration in the White House. It is increasingly clear that the president does not follow his own advice, and it is important that Americans follow the guidance that he is saying and not follow the example that he is setting by what he does. There does seem to be an impact to his casual attitude. Remember that for months he dismissed the coronavirus. He referred to coverage of it as the latest Democratic hoax, and he repeatedly suggested that it was no more serious than the flu. And as a result, it has become, unfortunately, a largely partisan issue. Democratic governors have taken aggressive measures to stop the spread of the disease in their states, while unfortunately Republican governors have been reluctant to do that. Out of the 50 states in the U.S., there are 9 which still do not have stay-at-home or shelter-in-place orders in effect, and all 9 of those are Republican states. Particularly distressing has been how Governor Ron DeSantis in Florida has been managing the disease. He has been condemned by the editorial board of the Miami Herald for his insistence for the longest time of keeping Florida's beaches open and encouraging spring break to happen as usual. And many public health officials have expressed concern that spring breakers who went to Florida and partied in close proximity with people from all around the nation have helped to bring the virus back to their states. The governor of Florida has belatedly put in place a stay-at-home order, but it still has an exemption that allows churches to continue to hold large gatherings. Another highlight of yesterday's briefing regarded Jared Kushner. Jared Kushner is the president's son-in-law. He has no experience in public health policy or emergency crisis management, and yet he is somehow a leading figure in the administration's response to this crisis. And he raised a lot of eyebrows on Thursday when he suggested that the Federal Emergency Strategic Reserve stockpile of medical equipment should not be made available to states. He said, quote, the notion of the federal stockpile was he said, the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpile that they then use. Now this runs entirely against the premise that was laid out on the Strategic National Stockpile website, which said explicitly that, quote, when states, local, tribal, and territorial responders request federal assistance to support their response efforts, the stockpile ensures that the right medicines and supplies get to those who need them most in an emergency. So that was right there on the stockpile website, and within 12 hours after Jared Kushner contradicted that language was removed from the website. So it is striking to note that this administration is capable of a rapid response to a PR situation, even if it is not capable of a rapid response to a global pandemic. Now, we're starting to get some questions from you in our comments, and thanks to Matt McDonough and Ian McKenna, we are going to pull some answers for you. Megan asks, if we are to wear masks, where can I actually find them without everyone hoarding them away? Well, I'll tell you, the guidance is that regular citizens should not be wearing medical-grade masks. We should reserve those for medical professionals. The guidance is that people just practicing safety should use more ad hoc methods. NowThis has released a do-it-yourself video of how to make your own mask. There are any number of ways that you can do it. Bandanas can be helpful. But yes, please, it is important that if you have access to actual medical-grade masks, that you reserve those for actual medical professionals. The CDC is recommending that any face covering is better than none, and that even a scarf or a bandana is better than nothing. This is not just to protect you, it is also to protect everyone else, because we now know that, we have known for some time that people who don't demonstrate symptoms can still spread the disease. The president was suggesting that that's new information. That's been known since January. The governor of Georgia says that he just learned that this week. It's been known since January. What is new is just how great a percentage of carriers of the disease may be asymptomatic. It's now believed that up to a quarter of everyone who has the coronavirus may not show any symptoms at all and may be still contagious, and can thereby get people who might be more at risk sick. Now, Kara asks, how long will the checks take if you had to close your bank account right before this all happened? Well, an NBC report on a memo circulated by the House Ways and Means Committee reports that the IRS will begin issuing paper checks to those who do not have direct deposit information during the first week of May. The memo says that it is estimated the department can process 5 million checks a week, meaning that to get to all those eligible, it could take almost 5 months. This is counter to what the administration has been saying. Treasury Secretary Steve Mnuchin was explicitly said, this money does people no good if it shows up in 4 months, and he personally promised that it would get out sooner than that. But he seemed to be oblivious to the situation of the many Americans who do not have bank accounts. And I believe that it's roughly an estimated 15 million Americans who do not have bank accounts. If you have a bank account, if you are accustomed to receiving a return on your taxes from the IRS that comes via direct deposit, you will most likely get your relief payment very quickly, but those who are awaiting an actual physical check, unfortunately, may be waiting for some time. Now, I want to take a moment because the president has repeatedly said that no one saw this coming and that no one could have planned or better prepared for what is happening than he and his administration have. The facts are very different, and I'd like to run through the timeline a little bit. But before I do, I just want to answer another question. Dina asks if homemade face shields are better than bandana. And Matt McDonough in our newsroom says you should absolutely make face shields if you have the materials, but donate them to a local health center. Face shields are only recommended by healthcare professionals who are coming into close contact with bodily fluids. So regarding the timeline that we've been looking at, and in terms of whether this administration could have responded differently, we need to go all the way back to 2014. In 2014, trying to learn lessons from the global health threat of the Ebola virus, which only amounted to a total of 11 cases in the U.S., the Obama administration formed a global health security unit within the National Security Council. And this team of experts would be on the lookout for risks around the world so that when a threat became known, something like the coronavirus, the U.S. could immediately begin taking actions to prepare. President Trump fired that team in 2018. It's unclear exactly why. He has said that it was a cost-saving measure. He has also denied that he did it, sometimes within the same statement. He will acknowledge that he did it as a cost-cutting measure and deny that he did it. But he did get rid of that team who might have seen this coming. The Obama administration also created a pandemic response playbook. They wanted to leave the next administration, whoever it was, with a set of guidelines, a set of instructions of here's what you can do if there is ever this kind of a threat. And unfortunately, whether it is just out of disregard for the Obama administration or out of a lack of competence, it's unclear. The Trump administration disregarded that playbook and did not follow any of its instructions. In 2017, reporting from Ken Klippenstein of The Nation says that the Pentagon had flagged that there was a potential shortage of masks, hospital beds, ventilators, and other equipment. The Pentagon warned the Trump administration of this in 2017 in a report saying that the most likely and significant threat is a novel respiratory disease, particularly a novel influenza disease. And so, again, the president keeps saying no one could have known that this was coming, but 3 years ago, the Pentagon was warning him that this could be coming. Now, then let's flash forward to this year. In January, it became clear that China had a problem. And that is when, had there been still a global health security unit in the National Security Council, they would have taken action. U.S. intelligence agencies in January gave President Trump classified briefings, and he could have at that point implemented the playbook that the Obama team had left behind. In January, Germany, long before there were any cases of the coronavirus in Germany, Germany began working on creating tests. On January 8th, the CDC issued its first warning about the coronavirus. This was on January 8th. On January 9th, President Trump held a rally. On January 14th, he held a rally. On January 18th, he went golfing. On January 19th, he went golfing. January 20th was a significant date in the world fight against the coronavirus. That was the first day that a case was diagnosed in the United States. It was also the first day that a case was diagnosed in South Korea. And if we're wondering what could a different response have looked like, we need only compare the response of South Korea. South Korea implemented widespread testing within the first 2 weeks. The U.S. did not. 2 days later, President Trump said, quote, "We have it totally under control. It's one person coming in from China. It's going to be just fine." The next day, January 23rd, Senate Minority Leader Chuck Schumer called for a public health emergency. The president disregarded this call. January 27th, candidate Joe Biden, who, as part of the Obama administration, had been part of putting together the Global Health Security Unit within the National Security Council, Joe Biden wrote an op-ed warning that the Trump administration was already failing to adequately respond to the coronavirus. January 28th, then candidate Elizabeth Warren released a plan for dealing with the coronavirus threat. This was before the President of the United States even acknowledged that it was a threat. That very night, President Trump held a rally. On January 30th, the World Health Organization declared a global health emergency. That night, President Trump held another rally. On February 1st, President Trump golfed. Only on February 2nd did a partial travel restriction on China go into effect. This was long after countries like Thailand had imposed travel restrictions on China. On February 2nd, President Trump said concerning the coronavirus, "We pretty much shut it down." However, during February, the disease continued to pop up around the world. On February 10th, when there were only 12 cases in the U.S., President Trump predicted that this would go away on its own in April with the heat. On February 15th, he went golfing. On February 19th, he held a rally. On February 20th, he held another rally. On February 21st, he held a rally. Only on February 24th did he finally ask Congress for additional funding to face the threat. But on the same day, he tweeted, "The coronavirus is very much under control in the USA. Stock market's starting to look very good to me." On February 25th, he tweeted, "The CDC and my administration are doing a great job of handling coronavirus." And he said, "I think it's a problem that's going to go away. They have studied it. They know very much. In fact, we're very close to a vaccine." Currently, all health experts say we are still probably about at least a year away from a vaccine. But on February 25th, the president was suggesting that we were very close to one. On February 26th, President Trump said, "You treat this like the flu. The risk to the American people remains very low. There are 15 cases within the U.S. Within a couple days, it's going to be down close to zero." There were, in fact, 60 cases in the U.S. on that day. The next day, February 27th, President Trump said, "Like a miracle, it's going to disappear." On February 28th, he held another rally, and referring to media reports about the coronavirus, he called it their new hoax. He has adamantly since denied that he's ever suggested that the disease was a hoax. He has said that it was just the coverage of the disease that he was calling a hoax. The coverage of the disease, that it was in fact spreading and that it posed a great danger, was accurate. It was not a hoax. The day after President Trump called it the new hoax, the U.S. had its first confirmed death from the coronavirus. That day, Washington State became the first state to declare a state of emergency. On March 3rd, this is after the first U.S. death, President Trump said things are going very well. At that point, we were up to 124 cases in the U.S. And he also said that it was by no means inevitable that it would spread across the country. Only on March 3rd, this is nearly 2 months after the CDC issued its first warning, only on March 3rd did the U.S. approve widespread testing. On March 4th, President Trump said, on March 4th, President Trump gave an interview to Fox News in which he suggested that people might be fine to go to work with the coronavirus. He later denied saying that. Later on the day, on March 4th, he said that it was, quote, very much in hand. On that day, there were 158 cases in the U.S. On March 5th, California and Maryland declared a state of emergency. On March 6th, Kentucky and Utah declared a state of emergency. That day, President Trump said, I think we're doing a really good job in this country at keeping it down, a tremendous job at keeping it down. Anybody right now and yesterday, anybody that needs a test gets a test. They're here, and the tests are beautiful. The tests are all perfect, like the letter was perfect. The transcription was perfect, right? This was not as perfect, but that was pretty good. This was on March 6th, when testing was still not available to most Americans, and today it is not available to most Americans who need or want it. On March 7th, New York declared a state of emergency. Also on March 7th, President Trump went golfing. On March 8th, he golfed again. On March 10th, he said, quote, it's really working out. It will go away. At that point, there were just under 1,000 cases in the U.S. On March 13th, again, this is more than 2 months after the CDC had first flagged its concerns, President Trump finally declared a national emergency. All right, members of the coronavirus task force are beginning to come out. And so as soon as the president comes out, I'll quiet up and I will stay quiet until the president starts speaking and there are facts that we need to provide more context on. But just to bring us up to the present day, March 13th, Trump declared a national emergency. March 16th, on a call with governors from around the nation, he told them that they were on their own to get emergency supplies. He said, quote, respirators, ventilators, all of the equipment, try getting it yourselves. As a result, numerous governors have said that they have been in competition with each other for supplies and that the cost of equipment has gone up astronomically. Governor Cuomo has said that the cost of N95 masks, which typically in the past have cost 7 cents a unit, have gone up by over 1,000% because he's competing with other states for the same supplies. On March 17th, President Trump finally labeled the disease a pandemic. And he said that he felt it was a pandemic long before it was called that. And now, here's the President of the United States.
Busy time, very busy time. And let me begin by, again, expressing our support, solidarity, and love for the people of our great country. We're fighting for you, and we're enduring all of this together. And we will soon prevail together, making a lot of progress. We appreciate all of the great assistance from the governors and people within the states. The relationships have been really very good. Spoke with Governor Cuomo. We're working very hard to get additional things to New York as quickly as possible. As you know, we took care of the hospital, including personnel, 2,000.
Now, the president is saying that he's done a very good job of getting supplies to New York. Again, the president and Jared Kushner have repeatedly scoffed at the estimates of the governor of New York that New York will need 30,000 ventilators within the next couple of weeks. The federal government has provided New York with just over 4,000, and President Trump has said that he is specifically withholding the additional 10,000 that he has in reserve.
Battling this pandemic is coordinating the delivery of the crucial supplies throughout the nation based upon the most accurate information available. And we've got the best health care and disaster experts anywhere in the world, and everybody will tell you that, and we're dealing with big parts of the world and helping them also through this horrible situation. We're at 151, still 151 nations are going through it. We're working to ensure that the supplies are delivered where and when they're needed. In some cases, we're telling governors, we can't go there because we don't think you need it and we think someplace else needs it. And pretty much so far, we've been right about that.
The president just said that this is in 151 countries. It is in 181 countries. And in terms of supplying states, Governor Cuomo said this morning that New York is able to get more ventilators from China and from Oregon than they are able to get from the federal government.
We're looking for an obvious focus in the hardest hit regions. Some of them are obvious and some aren't so obvious. They spring up, they come, and they hit you like you got hit by a club, an area that wasn't at all bothered. You look at what's going on in New Jersey. The governor's doing an excellent job, by the way, but how that sprang up. Every decision that we're making is made to save lives. It's really our sole consideration. We want to save lives. We want as few lives lost as possible. It's therefore critical that certain media outlets stop spreading false rumors and creating fear and even panic with the public. It's just incredible. I could name them, but it's the same ones always.
So the president is taking advantage of this press conference to attack the media, accuse the media of spreading false rumors and fear-mongering. The media has been reporting on actual numbers. It is the president who had consistently, as I laid out earlier, misrepresented the danger from this disease.
But then go back to your fake news. During a national emergency, it's just essential that the federal decision makers cut through the fog of confusion in order to follow the facts and the science. Many hospital administrators that we've been in touch with, even in the really hot spots, you know what they are communicating directly with us that their level of supplies are meeting essential needs, and at the current time, they're really thrilled to be where they are. Whenever local shortages are reported, we're asking states to immediately meet the demand.
It is hard to believe that what the president is saying is true when he says that speaking to hospitals are all telling him that they have what they need. We know that here in New York there is a great shortage. We know that here in New York doctors and nurses are being asked to reuse masks that were intended for single use. We have reported on nurses at a hospital here in New York who were wearing garbage bags as protective gear because they just simply did not have protective gowns.
Help supplement the states. Thousands of soldiers, thousands of medical workers, professionals, nurses, doctors, and it'll be a large number. We'll be telling them over the next very short period where they're going. They're going into war. They're going into a battle that they've never really trained for. Nobody's trained for this. Nobody's seen this. I would say since 1917, which was the greatest of them all.
The president is saying nobody's trained for this, nobody's seen this. Actually, as I highlighted earlier, public health officials and members of the previous administration specifically created a playbook and guidebook to anticipate a scenario like this and prepare for it, and the president disregarded that.
Locale, one city, and then all of a sudden they're starting to do well. We had some very good reports coming out of the state of Washington, coming out of various parts of California. So areas that we were getting ready to really hit hard, we can now go to other areas. It looks like New York is going to be hit very hard. And Louisiana is just amazing the way it just spread up. And everyone's doing a good job, but they're going to be hit hard. Areas in the country that are not experiencing large-scale infections are requesting supplies beyond what their present circumstances require. And we talk to them and we tell them and we explain it, and for the most part, they're good with it. We think we're right. It's very understandable that officials would seek to get the most they can get for their communities. But the fears of the shortages have led to inflated requests. We have some states and areas where they're just asking for far more. I mean, look, we had one state asking for 40,000 ventilators. 40,000. Think of it, 40,000. It's not possible. They won't need that many, and now they're admitting they don't need that many. But
all right, well, he is referring to the state of New York, and he is misrepresenting the truth. And he's suggesting that it is unfathomable that New York could need that many. New York State has over 100,000 cases of coronavirus so far. The state has suffered more than 3,500 deaths. And for him to suggest that it is not reasonable that the state could need 30 to 40,000 ventilators seems to ignore the actual state of reality.
Remember, we're a backup. We're the greatest backup that ever existed for the states, especially when we start getting into the hospital building business and getting into the medical center building business. When you see we built many hospitals, numerous hospitals in some states and medical centers. That's why my administration's been requesting actual usage numbers directly from the states and hospitals to meet their needs, because we want to be ready when the brunt of it comes, which is coming quickly. You see it. You see it as sure as you can see it. And when the brunt of it comes, we want to be ready to hit the area that needs it. We don't want to have spent everything in one area and they don't need it there to anywhere near the extent. So let me be extremely clear about one point. We will move heaven and earth to safeguard our great American citizens. We will continue to use every power, every authority, every single resource we've got to keep our people healthy, safe, secure, and to get this thing over with. We want to.
So the president repeatedly says that we are using everything in our power, but the fact is that we are not. The president was very slow to invoke the Defense Production Act and still has not invoked it fully. The president could have ordered back in January, when the intelligence community was warning him of the imminent threat, he could have ordered companies to start producing ventilators. Beginning to produce them now is too late. He could have ordered all clothing companies to begin producing masks and gowns. And when the president refers to getting ready for a big outbreak somewhere, he seems to be disregarding the state of what is actually happening at ground zero in New York. New York now has over 113,000 confirmed cases. He's saying that he's holding on to this gear so that he can have it available when an emergency presents itself. It's hard to imagine what an emergency looks like if it is not 113,000 cases in a single state.
Roger Penske, founder and chairman, Penske Corp., and Drew Fleming, president of the Breeders' Cup, and there were a couple of others on, and these are all the great leaders of sport, and they want to get back. They got to get back. They can't do this. Their sports weren't designed for it. The whole concept of our nation wasn't designed for it. We're going to have to get back. We want to get back soon, very soon. For example, and I have to say, we're using the Defense Production Act very powerfully. In some times directly, in many cases indirectly, just the threat of it's usually enough. but FEMA and HHS have ordered 180 million. Think of that, 180 million. Who ever heard of 180 million N95 masks? And we're working now with 3M to see whether or not that all works out, but we want them to help our country. And I think it's going to be okay. We're going to soon let you know, but we need the masks. We don't want other people getting it. That's why we're instituting a lot of Defense Production Act. You could call it retaliations, because that's what it is. It's a retaliation. If people don't give us what we need for our people, we're going to be very tough, and we've been very tough. Usually we don't have to use it, but we've used it plenty. It's turning out more and more, unfortunately.
The president has not been reluctant to use the Defense Production Act for other purposes. The New York Times reported that he has used it literally hundreds of thousands of times to acquire military assets, but he has been strangely reluctant to use it to require companies to make the gear that is needed in our hospitals.
180 million N95 masks. 180 million. Who ever heard of 180 million masks? And this is a incredible thing. A lot of times when we have to
The president's talking about 180 million masks as a large number, and it does sound like a large number, but the Department of Health and Human Services estimates that the United States will require 3.5 billion of those masks to cover this pandemic if it lasts a year, as is looking more and more likely.
They say, how's the president doing? He should have given more, because that's politics. That's politics. And that's unfortunate, because we can't play that game. And, that's one party doing it, and the other party's happy. But they're all really happy, because they should have been doing this work themselves for a long period of time. Many of their cupboards were bare. With respect to the ventilators, FEMA and
This is, the president keeps falsely suggesting that governors are asking for more than their health departments are telling them that they need. Johns Hopkins says that roughly 6% of all people with coronavirus will need ventilators, and therefore, at the rate that New York is developing cases, it seems accurate that New York will, in fact, need the 30,000 ventilators that the governor is asking for. The governor is currently warning that New York will be out of ventilators by Monday. Also, President Trump says, whoever heard of 80 million masks? 3M makes roughly 400 million per year. They're increasing their production by 30%, but they normally make 400 million.
And they hit one, they hit another, they hit another state, they hit areas that you didn't expect, but we're watching it and we're capturing it. Our goal is to stay several days ahead of the needs in each state, but we can only do that if the cities and states utilize real-time local knowledge to provide timely and precise data about actual usage. So we have to be able to do that. And
Well, the state of New York has said that it will be out of ventilators by Monday. The state of Louisiana is also predicting that it is just about to run out of ventilators, and President Trump and Jared Kushner have been reluctant to accept those numbers.
So we're going to need some additional. We're moving some into New York City and state separately, and we're bringing them to the point where they'll need them. I can also report that at my direction, 1,000 military personnel are deploying to New York City to assist where they're needed the most. That's the hottest of all the hot spots. New Jersey is right there. It's right next to it. And I don't know if that's overflow, but New Jersey's, it's a great state, and it's a crowded state also, where you have people on top of people. It's always tough, but we're bringing some of the ventilators. We got some for New Jersey just yesterday, and we're going to bring them some more, including doctors. We're getting doctors.
New Jersey had requested 2,500 ventilators. The last numbers I have show that they got only 850.
Doing it on a larger basis, and I want to thank Secretary of Defense Esper, who will detail some of what we're doing tomorrow and Monday. As the situation in Washington state continues to stabilize, we're returning a 300-bed federal medical station to a different location, so where we need it, and we appreciate that. They won't be needing it, and we appreciate them letting us know we're going to move it to a different location. It was already built. Many governors initially made large requests for federal support for their states in anticipation of a greater number of cases, but the residents of Washington state have done a really good job of following the federal distancing guidelines. They really have. I'm also pleased to report that Oregon will be spending and sending. They're spending a lot of money because they really did stockpile well, and they're also sending 140 ventilators directly to New York, which we appreciate. And I want to thank the Vice President.
As we'd mentioned a moment ago, Governor Cuomo said that he is having more success getting ventilators from Oregon than from the federal government.
I want to get it over. He's got to get a little more sleep than he's getting. He hasn't been getting very much, I will tell you that. And we're all in this together, and it's a beautiful thing to see how people are joining forces to help one another.
The president is highlighting that we are all in this together. Let's remember that moments earlier in this press conference, he attacked the news media as fake, and he has dismissed the concerns of governors, Democratic governors, and suggested that they have not been doing their jobs.
And we all do. He's a great senator. He's a great person. We spoke just this morning, and we discussed how important it is to keep our farmers and ranchers, processors, and distributors in our nation's prayers. And I want to thank the senator for the incredible job he's been doing.
The president is right to thank our farmers. Our farmers and farm workers are the people who have been keeping food on our table throughout this crisis. He has this week taken several opportunities to attack undocumented workers. Roughly 1 million farm workers are undocumented, including 60 to 75% of California's farm workers. They work in cramped, close conditions and have few measures taken to protect them from this disease. Their risks that they are taking with their own lives are what is keeping America fed. And it's important to remember that before attacking them.
Program which is expediting the development of new antiviral and other therapies, and they're doing it on a very rapid basis. And I think we're having some very good results. We'll tell you about that. HHS continues to speed the development of therapies derived from human blood that have the potential to lessen the severity or shorten the length of the illness. And as you know, last Saturday, the FDA also gave emergency authorization for hydroxychloroquine, and the hydroxychloroquine is I hope it's going to be a very important answer. We're having some very good things happening with it, and we're going to be distributing it through the Strategic National Stockpile. It's going into the Strategic National Stockpile to treat certain patients, and we have millions and millions of doses of it, 29 million to be exact. In addition to that, we're making it, and we're also getting it from various other locations and countries. In one case, I called Prime Minister Modi of India this morning. They make large amounts of hydroxychloroquine, very large amounts, frankly.
The president has continually been expressing a greater level of optimism about hydroxychloroquine than the medically trained members of his team. We're going to pull a little bit more information about this for you, but one of the most important things I want to advise you is not to go seeking that chemical on your own. A couple in Arizona, misunderstanding the guidance from the president, ingested fish tank cleaner, and one of them died.
And it will be arriving. We're just hearing really positive stories, and we're continuing to collect the data, but I'll just speak for myself. It's been out for a long time. It's a malaria drug. It's also a drug for lupus. And there's a study out that people with lupus aren't catching this horrible virus. They're not affected so much by it. Now, maybe that's correct. Maybe it's false. You're going to have to check it out. But there's a lot of very positive things happening.
All right, so there has, in fact, just been one study on hydroxychloroquine, and one only, and that study showed nothing clinically meaningful. It did not show a reduction in death, intubation, heart failure. It just showed faster time to clear the virus from nasal swabs. Dr. Fauci keeps refuting that this should be widely used until there has been an active study with live viruses. The president is right that this is a medicine that can be used to treat lupus, and there has actually been a shortage of the medicine for people who need it to treat lupus because, in part, there has been a rush on pharmacies to try to get this. Also, the president's statement that people with lupus are not getting the coronavirus, that is not backed up by the facts. People with lupus are getting the coronavirus, and they are susceptible to it. And in fact, they are at greater risk because they have a serious underlying health condition. Then in response to the president's claim that India makes a lot of it, in response to the talk of hydroxychloroquine, the Indian government moved to make the drug under a stricter schedule of drug law to prevent mass hoarding in the country. There seems to be unfounded belief that this will be a cure, and the president is fueling that, and that seems to be making the jobs of healthcare professionals harder.
And J.P. Morgan Chase and a lot of the big banks that have been involved, and a lot of the community banks have really jumped on it, and it's so far going way ahead of schedule. The SBA also clarified that faith-based organizations, including houses of worship, are eligible for the Paycheck Protection Program. That's great, as well as the Economic Injury Disaster Loan Program that you're familiar with, on the same terms as every other applicant. If we run out of funding for the Employee Retention Program, I will immediately ask Congress for more money. This is money that's really going directly to the people that need it, the small businesses that need it, and the workers that need it.
The president has been calling on companies not to conduct layoffs. It is worth noting that the Trump Organization has laid off at least 1,500 people during this crisis.
Got to shut it down, stop it, tell everyone to stay home because of this horrible virus, and we did that. And we did the right thing, but now we have to open. We have to open our country. Finally, I can report that as of today, the State Department has successfully coordinated the safe return of more than 40,000 Americans stuck abroad on over 400 flights from 75 countries. Many of those countries were terrific in helping us, and I appreciate that very much. Some of them I had to call the leaders of the country, most of whom I know. And once I did, they snapped like you wouldn't believe. They really helped us great. So I appreciate that. So we brought back 40,000 Americans who were literally stuck in some countries with no chance of getting out. We got them back. 400 flights, 75 countries. Think of that. And those countries in almost every instance had a big problem with the virus. I want to thank the American people, most of all, for the selfless sacrifices that they're making for our nation. I know it's not pleasant, although some people have said they've gotten to know their family better, and they love their family more than ever. And that's a beautiful thing. They've actually gotten to know them. They're in the same house with their family for a long time. I guess it can also work the other way, perhaps, but we don't want to talk about that. And I want to encourage everyone to keep following our guidelines on slowing the spread. Sustaining this war effort is, and that's what it is a war effort, is the patriotic duty of every citizen while we...
It is striking that the president keeps comparing this to a war effort, but also keeps suggesting that it is not reasonable for states to expect support from the federal government, and that the states should primarily be responsible for fighting this epidemic. It is worth noting that that is exactly the opposite of how a war effort would work. And when Pearl Harbor was bombed, FDR did not just say, Hawaii, good luck dealing with that threat. That is just not how the United States or any country would conduct a war.
Has ever seen anything like that where it's so contagious you can be feet away and just talking to somebody?
The president is also saying that this is the most contagious disease that we have ever seen. That is simply false. There are many diseases that are more contagious than this one.
We're going to make sure that it's over soon, and just keep going. It's not going to be long, and thank you very much. And with that, I'd like to ask Dr. Hahn to speak, and he's been doing yeoman's work at the FDA. Thank you very much, Doctor. Thank you. Thank you.
Thank you, Mr. President. I'm going to speak about hydroxychloroquine and the efforts around that. Just to preface, I'd like to echo what the President said about the American people and the resiliency and the just terrific work. Mitigation is such an important part of our fight against the COVID-19 virus. Last week, as the President said, we issued an emergency use authorization to allow the donated hydroxychloroquine to come into the country and enter the general circulation. We are prioritizing this drug to come in for clinical trials, also into general use for physicians, because as you know, physicians, based upon their interaction with the patients, their assessment of the risks and benefits, can write a prescription for hydroxychloroquine if they think it's appropriate for the patient. Being a physician, we do this all the time, and that assessment needs to be done between a patient and a doctor. And then the third portion is we wanted to make sure that these drugs were in the circulation, in the supply chain, so that people who have them or need them for the other indications, lupus, rheumatoid arthritis, had them available. So that was the purpose of the emergency use authorization. One other thing I'd like to mention is that we on Friday stood up a formal convalescent plasma program. We have a great deal of enthusiasm for that. There are some reports that this is of benefit to patients in other countries who have had the COVID-19 virus. And what this means is taking plasma from patients who've had the virus and who have recovered and transferring the immunity, the immunoglobulins, if you will, the immunity from that person to someone who's sick. And we're hopefully expanding that across the country. The Red Cross is involved in that program, and I think it shows a great promise. It needs to be studied like other things, but just like I said before, it provides hope. We don't want to provide false hope, but definitely hope. Thank you.
Thank you very much, Mr. President. I'd like to just take a couple of moments to talk a little bit about the public health aspects and how it relates to what the President just said about the need for us to begin to at least think about returning to some degree of normality. And that has to do with what's going to be happening as we end this week and we go into next week. You will be seeing, and we should not be surprised because the kinetics of how this virus works is that we're going to be seeing that there are going to be deaths that are going to continue to go up. But as I mentioned to this group and to the general public multiple times, there really is a cascading of events where you have new cases, hospitalizations, intensive care, and deaths. So at the same time that we may be seeing an increase in deaths, we want to focus on the effect of mitigation is really the number of new cases. And that's what we're going to be thinking about and looking about. So we're going to pay close attention to that, and hopefully the kinds of mitigations that we're talking about are going to have the impact to allow us to begin to think about maybe changing a bit. So the question arises is the mitigation working? So let's look historically and then just look at the reality of it. Clearly in the countries, China included, that have implemented since very strict kinds of programs of mitigation, clearly it works. In our own country, we've seen indication of that in Washington. Remember, Washington State was the first to get hit, but they put in a really good program of mitigation. And if you look at the charts that Dr. Berg showed the other day, they're still down there doing well. And the reason is, again, what I've said before, but I think it's worth reiterating. that we have two opposing forces here. The virus, which wants to do what the virus wants to do. Viruses transmit from people to people. When people are separated from each other, virus does not transmit. It doesn't go anywhere. And that's the reason why something as simple as the physical separation, because if you look at the Vice President's chart that he shows all the time here from this podium, every aspect of that ending the COVID outbreak in 30 days has some aspect of it of physical separation, whether that's avoiding crowds, whether that's staying 6 feet away from people, whether that's doing teleworking. All of it does that. That's our most important tool. We'll be talking about vaccines and drugs and things like that that will mitigate later. But this is what we really have to do. And I want to actually just plead, as I do multiple times from here, to the American public, you know, as sobering and as difficult as this is, what we are doing is making a difference. So we really need to continue to do that. I must tell you, I was just mentioning to the Vice President as we came in, last night when I wasn't here, I went out with my wife and actually did a little power walking down Massachusetts Avenue. For those who live in Washington know what I'm talking about. And we passed a couple of restaurants where people were getting takeout food. The restaurants were closed to people going in, but they were open to takeout. And I saw something that absolutely made me feel really, really good. They were separating themselves by at least 6 feet. In fact, some of the restaurants had little things on the floor that said, stand here and then stand there. And I think if we as a nation pull together to do that, hopefully when we keep coming back here at these press conferences, we'll be able to show you that that curve that we keep talking about is going in the right direction. And I'll be happy to answer questions later. Thank you.
It might be easier for Dr. Fauci to make the point about the importance of social distancing if the president and his team implemented that at their own briefings. You will see that the governors who have been taking this threat seriously have all been standing at least 6 feet apart from other members of their team as they hold their daily briefings, but the president stands just inches away from the people near him. A fun fact about Dr. Fauci and power walking, he said, quote, "I love to run. It is one of the few things I don't need much motivation to do." He said this to the National Institute on Aging in 2016 for a series of videos with health officials on what benefits them.
Mr. President, you mentioned the military off the top. So 1,000 troops going to New York. And then are we expecting other mass deployments around the country? And then is it just the Army? Is it...
No, not mass. Many of the places are really in great shape. They really have done a fantastic job. And we may add to the 1,000, but New York will be getting about 1,000 military people, nurses, doctors, lots of other people, because that's what they need. Yeah, and that's medical. No, medical military, please.
Sir, you tweeted earlier today that you liked the idea of a second coronavirus task force that was focused on reopening the economy.
Thinking about it.
So I was wondering if you were planning to go forward with that.
Thinking about getting a group of people, and we have to open our country. You know, I had an expression, the cure can't be worse than the problem itself, right? I started by saying that. And I continue to say it. The cure cannot be worse than the problem itself. We've got to get our country open.
The president has repeatedly warned that the cure could be worse than the problem itself. It is important to note that the idea that this is a choice between the economy and lives is a false choice. The economy cannot function without living people. We know that if social distancing guidelines are not used, that there is the potential for more than 2 million Americans to be killed by this, and that would be more destructive to the economy than anything that is currently happening.
We need it for this period of time, but eventually people are going to be able to occupy those seats and arenas.
Also, I think the president just claimed that he originated that phrase. That is a very old phrase. He did not originate it.
And, some restaurant man called up. He said, "Yeah, I'm worried because I have a small restaurant with not too many seats." I think he said 120. And he said, if I practice what this is, I'm down to 30 seats. I can't make it. I said, don't worry about it. That's for a short period of time. You'll be back to your number of seats. We can't do that. Otherwise, you're making everything. That means your stadium is half the size of what it was a month ago. No. They're going to be close together, but they're going to be breathing air that's not infected, that's not going to kill people. Please.
Since you're not committing to pack the stadiums by August, what are your contingencies?
Well, I'm not committing to it. I'm not committing to it. We're going to see where we are. That'd be great if we could. But we're going to be back to good health soon, in my opinion. We're making a lot of progress. And we're making progress because, as Tony told the story about the restaurant and about how they were separated sort of automatically, people are doing that. People are doing that. They're staying in their homes. They don't want to go out. They're doing what they know is the right thing to do. It's not very complicated. It's, in many ways, it's a very beautiful thing to see. Yeah.
Contingency plans for the Republican National Convention?
We have no contingency plan. We're having the convention at the end of August, and we think by the end of August we'll be in good shape. We have no contingency. It's going to be in North Carolina, as you know, in Charlotte.
I do want to say, so the president has just said that a small restaurant owner called him to express his concern. It is hard to prove that this is false. It is also very hard to imagine that the owner of a small restaurant was able to phone up the president of the United States and have this conversation with him.
We're working on the next round of relief packages. What was not in the stimulus package that you signed last week that you would like to see in phase 4?
Well, I think we're going to need more money for the small businesses. It's been working out so well. It's been so efficient. The banks have been doing an incredible job. I think we're going to need more money there. I think, we'll see. But based on the first couple of days, it's been incredible. I think that restaurants and entertainment, that would include sports leagues, all forms of entertainment, go back to the original where they get tax deductibility for what they're doing, and for people come in and buy tickets or go out for meals, and corporations can then send people into these restaurants who are going to have a hard time otherwise opening, in my opinion, and that could be the same for the sports leagues. So we want to see for entertainment and for restaurants deductibility so that corporations can take a deduction. They'll send their executives, they'll send people there, and they get a deduction.
This is a very odd claim that the president has been making a lot recently, that the solution to fixing the economy after this is to make meals and entertainment more tax deductible. There is no evidence that additional tax subsidies are going to be enough to improve restaurant business economics.
Dr. Fauci have said stay-at-home orders are the most effective way to stop the spread of this virus. So why not do everything possible and urge those governors right now to do that?
We have a thing called the Constitution, which I cherish, number one. Number two, those governors, I know every one of them, they're doing a great job. They're being very, very successful in what they're doing. And as you know, I want the governors to be running things. Now, in some cases, we'll supersede. But in this case, it's not.
See, and this is part of what is so confusing about the president's response, is that he does not seem to want to take initiative. He keeps comparing this to a war, and while it's not a perfect analogy, there are some aspects to it that are appropriate. And as commander-in-chief, he is in a position to coordinate national response, and he seems to be continually refusing to do so. And as Dr. Fauci pointed out, Dr. Fauci this week was calling for saying that there would be a need to have some sort of nationwide stay-in-place order. Multiple governors have said that their own state stay-in-place orders are only as strong as the weakest link, and that America's preparedness is reduced to a lowest common denominator situation as long as there are some states that are reluctant to putting such measures in place.
We have to get this country open, Jeff. It has to get open. This country was not designed to be closed. So we have the greatest we've ever had, and then we're paying people to stay home? Think of it. We're paying people not to go to work. How about that? How does that play? And they want to go to work, by the way. They don't want money. This country is great. But we're paying people We have to get back to work. That's what I'm saying. Go ahead, please.
Mr. President, this is off topic. It's about the announcement from last night. It's a yes or no question. Not that we expect the answer to be yes or no. But wasn't Michael Atkinson doing the job of the Inspector General of the intelligence community, the job he was supposed to do when he simply took the whistleblower complaint to Congress that what hadn't been taken previously? Wasn't he doing the job that he was supposed to do, that American taxpayers were paying him to do? And why did you decide to terminate?
I thought he did a terrible job. Absolutely terrible. He took a whistleblower report, which turned out to be a fake report. It was fake. It was totally wrong. It was about my conversation with the president of Ukraine.
Okay, the president is going off on the whistleblower report about his call with Ukraine. It was not fake, and in fact, the transcript that he released, which was not a complete transcript, confirmed what was in the call. Numerous witnesses have confirmed the accusations, and the president was impeached because numerous witnesses confirmed, the acting White House chief of staff confirmed, and the president, speaking off the cuff, confirmed in his own language that he was making aid that had been allocated by Congress to Ukraine contingent upon receiving a personal political favor from Ukraine.
Fraudulent or incorrect transcript. So we offered this IG. I don't know him. I don't think I ever met him. He never even came in to see me. How can you do that without seeing the person? He never came in to see me, never requested to see me. He took this terrible, inaccurate whistleblower report, right? And he brought it to Congress. We offered to have him see my exact conversation. It was all about the conversation, by the way. That was the whole thing. It was about the conversation, right?
So President Trump is falsely claiming that the whistleblower's report was false and is complaining that the Inspector General called attention of it to Congress, which in fact was his job. That is the Inspector General's job.
Conversation. Well, it was a fraud. I didn't say that. And by the way, you have the whistleblower. Where's the informer, right? And here's another question. Remember, before I gave the transcript, in other words, before I revealed the real conversation, where's the second whistleblower? Remember the second?
The president has seen fit to focus on the idea of trying to identify the whistleblower. In fact, numerous Republican members of Congress have tried to out the whistleblower's identity, but the identity of the whistleblower is irrelevant. A good analogy would be like, this would be like obsessing over who placed a 911 call when someone witnessed a crime in process. The fact of the matter is that eyewitnesses came out detailing what the president had done, and it doesn't matter who the person was who dialed 911.
In the Ukraine, foreign minister said he did nothing wrong. And over that, with 196-0 vote by the Republicans, not one dissenting Republican vote, dishonest Democrats impeached a president of the United States. That man is a disgrace to IGs. All right, let's go next.
All right, what the president has said is false. The Inspector General was not a disgrace to IGs. The Inspector General did his job. President Trump, who moments ago said we have a constitution and I want to uphold it, is trying to make the argument that the President of the United States is not subject to oversight.
Ask him, why didn't you go and see the actual conversation? There was no rush. He said, oh, we have to rush it. He even said it was politically biased. He actually said that. The report could have been, you know who the whistleblower is, and so do you, and so does everybody in this room, and so do I. Everybody knows, but they give this whistleblower a status that he doesn't deserve. He's a fake whistleblower.
He's not a fake whistleblower. The concerns that were flagged have been proven to have been true. And the whistleblower, under the law, is entitled to some protection, and the whistleblower's identity is irrelevant to the case since there are, in fact, eyewitnesses who have testified in the impeachment trial as to the veracity of the complaint.
If you'd like their name, I'll give you their name. No, but the governor didn't mention that. It came through the Chinese, the country, of China. But they were given by two friends of mine. But he didn't tell you that. Now, the governor also, you'll see when you read the letter, the governor also asked for 40,000. He wanted 40,000 ventilators. Now, the governor, as you know, had a chance to get 16,000 a few years ago. He decided not to get that. The state of New York has asked for help. I've given them 4 hospitals, 4 medical centers. Then I gave them an additional hospital. Then I gave them military people to operate the hospital. They were not supposed to be COVID hospitals. The ship is not. Interesting thing happened with the ship. People aren't in accidents because there's nobody driving. There's nobody taking motorcycle rides down the West Side Highway at 100 miles an hour. People are away, so people aren't being injured. Now they're asking whether or not we could open up the ship for COVID. We have given the governor of New York more than anybody has ever been given in a long time. I'll just say, I was going to say in history, but in a long time. And I think he's happy. But I think that, because I watched what he said today, and it was fine. I wouldn't say gracious. It wasn't gracious. It was okay. I must tell you, Gavin Newsom has been gracious. Los Angeles.
Okay, this is very striking what the president is saying. He has returned to complaining that governors aren't showing sufficient appreciation. He is saying that New York has been given more than has often been given. That is true. That is because New York is under more of a crisis than any state. There are over 113,000 cases of coronavirus in New York. The president is repeatedly acting as if it is preposterous that New York would need 30 to 40,000 ventilators when Johns Hopkins estimates that a full 6% of everyone who gets the coronavirus will need ventilators. And at this rate of infection that is growing in New York is indeed on track to be out of ventilators within a matter of days. Also, just in terms of the complaint that New York is getting too much, it is worth noting that New York contributes nearly $150 billion to the federal budget. That is about 9% of the total budget. New York is what is known as a donor state, one of the states that contributes more to the federal budget than it receives in services.
School closures and distancing and staying at home and all of these pieces that had never really come into the model before. They're working on that very diligently now. Of course, just to be clear, we won't know how valid the models are until we move all the way through the epidemic. What we're triangulating right now, and instead of working on R0, we're looking at testing and triangulating testing, test positive cases, hospitalizations, ICUs, and of course, the recoveries, because that's also very important to us. I think it's very important that the American people know that there are equal number of states with less than 5% positives despite high levels of testing. So there are states that are mitigating and making this work. There are also the states that you know of, the 18 states that have the larger outbreaks, and we're watching them very carefully, triangulating for them all of the information to ensure that clients who come to the hospital are cared for. And then there's states in the middle that we're trying to figure out, are they changing or not? Each of those states and each of those epidemics within those states may have a different R value. And that is what we're trying to figure out, and it's very variable on each of these factors. But the bottom line is, and I think going into this weekend, it's really important for the American people to know this, Spain and Italy are moving through this. They are seeing their number of cases drop. They're seeing the number of people in hospitals drop. We are about, on our models and on the actual data, about 12 days behind them. At the same time, we see in the United States really good case studies of the impact at Washington State, of California, and then a series of smaller states where we're trying to learn from them how to do surveillance. And with these new HHS, Abbott ID Now kits, and I just want to thank Admiral Girard for getting them out, being able to look at testing in a more comprehensive way so we can be doing surveillance and mitigation simultaneously so we can answer that very question. It's going to be very difficult to answer at this moment across the United States because each metro cluster is on a different pathway as they move through the epidemic. And I think we just really ought to emphasize through, because we see Italy, we see Spain moving through, and we hope to be in that same position. At the same time, as the president said, he's concerned about every single person that is succumbing to this virus. We all are. And that's why we're making sure that in this triangulation, they're tracking minute by minute. When we say FEMA and HHS is tracking minute by minute the ventilator, hospital, and ICU bed need, that's exactly what's happening. And also being flexible and responsive. To have DOD take 1,000 healthcare providers out of their medical corps is a very big deal. I was in the medical corps for 29 years. We never did that. So this is saying we respect and understand the importance and value of the American lives and doing that. But the R values will be variable by state.
That phrase, we respect and value American lives, is striking to put in comparison to the statement the President repeated again earlier today, saying that we cannot let the cure be worse than the problem, implying that preventing American deaths at some point is less important than protecting the economy.
Now, had we allowed thousands and thousands of people from a specific area, I don't have to go into it, from China, to come in highly infected, it would have been a very different thing. The other thing, so I appreciate the fact that he did, because I was called xenophobic, racist, I was called many things when I did that very early.
The President repeatedly claims that he was called racist and xenophobic for placing these travel restrictions on China. This is a misleading statement. He has often been called racist and xenophobic, but not for that. There, in fact, was no criticism from either Democratic congressional leaders nor Democratic presidential candidates to the ban. Factcheck.org was unable to find a single instance of Democrats saying that the travel restrictions were themselves racist. The president has claimed that he has saved thousands of lives by putting these restrictions in place. The fact of the matter is that he restricted travel from China far later than other countries in the world did. And Dr. Jennifer Nuzzo from Johns Hopkins says, quote, "We have not seen any evidence that shows that the travel restrictions stopped or slowed down transmission of the virus that causes COVID-19. And the reason for that is because the virus was already in the country. The U.S. had its first confirmed case on January 20th, and these restrictions, which were not total restrictions, did not go into effect until February.
20 that were infected. Now, I guess the captain stopped in Vietnam and people got off in Vietnam. Perhaps you don't do that in the middle of a pandemic or something that looked like it was going to be. You know, history would say you don't necessarily stop and let your sailors get off, number one. But more importantly, he wrote a letter. The letter was a 5-page letter from a captain. And the letter was all over the place. That's not appropriate. I don't think that's appropriate. And these are tough people. These are tough, strong people. I thought it looked terrible, to be honest with you. Now, they made their decision. I didn't make the decision. Secretary of Defense was involved, and a lot of people were involved. I thought it was terrible what he did. To write a letter? I mean, this is...
The president is again doubling down on his idea that there should be no whistleblowers. He's talking about Captain Brett Crozier of the Roosevelt. Captain Crozier warned that if we do, quote, "if we do not act now, we are failing to properly take care of our most trusted asset, our sailors." He was complaining about the inability to implement quarantine and isolation procedures because the virus was spreading on his ship. After raising these concerns, he was relieved of his command. Captain Crozier also said, "Sailors do not need to die."
Responsible for the coronavirus, but he is responsible for failing to prepare our nation to respond to it. How do you respond to that, sir?
He didn't write that. That was done by a Democrat operative. He doesn't write. He's probably not even watching right now. And if he is, he doesn't understand what he's watching. But just so you understand, it was very nice what they wrote out. I don't know, they released it at a strange time, sort of a strange time to release something like that. But he admitted I was right. And if you read the Federalist story, which most of you won't, because you don't want to, but you'd learn something, because if it goes through a chart, times. I was early. Dr. Fauci, I don't think he's changed his mind, but he said it was a very important step when we stopped China from coming in from the specific area that was heavily infected. We'd have a whole different thing right now. So I don't really know what Joe Biden said. I don't really care. And again, I see every once in a while I'll say something, I'll make a speech, and then it'll be critiqued, and I'll get this beautiful, brilliant critique. Joe Biden didn't write that. Joe Biden didn't write that. He wished he did, but he didn't. Go.
All right, so the president who was saying that we need unity at this moment is taking his time to attack Joe Biden, and he's also falsely claiming that he was acted earlier than people called for him to act in response to the virus. Joe Biden, in fact, wrote an editorial on January 27th complaining that President Trump was failing to adequately respond to this crisis. President Trump did not declare a national emergency until March 13th.
What we need to have in place, and we will have that in place, is that as you then pull back, you have to have the capability of, in a very pristine, precise way, do the kind of containment when you do see it. Because remember, when you get to mitigation, containment takes the back seat because you're just struggling to mitigate. But when you get it down, you need to make sure it doesn't resurge. So that will require the ability to test, to identify, to isolate, and to do contact tracing. That's what we have to have in place, and hopefully we will at the time that we then pull back.
Question for Dr. Ahn from the FDA. You mentioned the plasma, sir. So this plasma that people that were infected that have now either recovered or are doing well enough, and then they're transferring it to, is it family members? Can you walk us through that's working, and is it kind of like a case-by-case basis in certain hospitals? What are the results from that? I just was not familiar with that.
So this is a situation where someone who's recovered from the virus, doesn't have the virus in their system at all, you can take plasma, and this is a pretty routine procedure. You can actually donate a couple times a week, a couple times a month, frankly, and give that plasma. That plasma contains the proteins in the blood that have the antibodies against the virus. You can take that, process it, and then give it to someone who's ill. And so that allows you to transfer that immunity. It doesn't have to be matched by family or anything like that. Since last Tuesday, the Tuesday before last, we've allowed academic centers and other laboratories and hospitals around the country to do this on a compassionate use basis. What we did was we pulled this together in what's called an expanded access program and run it through the Red Cross because they've got the greatest system and capacity for doing this. And this allows us to scale up so that when people get sick, we can actually have these donated plasma packs given to the patients who are sick.
So do people need to be donating plasma? Obviously, some of us don't know we had it and recovered. What should people be doing?
So we've started with the Red Cross in this program. We made an announcement yesterday. We are planning to actually scale that up, and we'll have more information this week because we want to make sure we have the systems in place. It's a superb question.
Thanks, sir.
Right, Jeff, go ahead.
Mr. President, can you clarify the situation with 3M right now? Germany said that it was an act of piracy, that 200,000 masks were apparently diverted from Thailand to the United States instead of to Berlin. Is that a miscommunication? Did that actually happen? And should 3M be fulfilling contracts?
We're very disappointed in 3M. They should be taking care of our country, and they can sell to others, but they should be taking care of our country. The people that have dealt with them have dealt successfully with many companies over the last month. They don't like the way 3M has treated our country. They don't, frankly, like the representatives of 3M. And no act of you said piracy, right? Piracy?
For German.
There's been no act of piracy. No, there's been no act of piracy. It's the opposite. 3M has not treated our country well. And if they do, great. And if they don't, they're going to have a hell of a price to pay. Okay? I say it that way. And I watched him on television on something talking about how this is so hard to believe, so hard to fathom. They ought to get their act together, because I got involved and I looked at what happened, and they have not, 3M has not treated our country well.
Just clarify about that German order.
Go ahead, please.
Was that converted, or was that not?
We'll get you the information.
I was wondering about what you're seeing as far as lupus patients in regards to coronavirus. I know the president mentioned this earlier, but what is the medicine saying?
What is the question? Is that what is the incidence of coronavirus?
Do you have lupus? Do you have a greater chance of getting coronavirus?
There's right now. This is being looked at in a natural history study. We don't have any definitive information to be able to make any comment on that. It's an obvious good question, because it might be a way for us to get some interesting and potentially important data as to the role of those medications. But that's something that is now being looked at, but we don't have any data to be able to say anything definitively.
And I hope they use the hydroxychloroquine, and they can also do it with Z-Pak, subject to your doctor's approval and all of that. But I hope they use it, because I'll tell you what do you have to lose? In some cases, they're in bad shape. What do you have to lose? It's been out there for a long time, and I hope they use it. And they're going to look at the...
Okay, the president's obsession with hydroxychloroquine is puzzling. Again, there has only been one study, and its results did not show anything particularly meaningful. Dr. Fauci was asked if the president was correct when he claimed that patients who are taking hydroxychloroquine for lupus are finding immunity to the coronavirus. There is no evidence that that is the case, and Dr. Fauci basically said that as much, slightly dodging the question. The president also just made a reference to Z-Pak. Z-Pak is an antibiotic. Antibiotics kill bacteria, not viruses. While it could be useful in treating a secondary infection, which can happen during a case of respiratory illness, Z-Pak would not be a method of treating the coronavirus itself.
Very little of this virus. I don't know. You're going to check it out. But I think people should, if it were me, in fact, I might do it anyway. I may take it. Okay? I may take it. And I'll have to ask my doctors about that. But I may take it. Yeah.
The president is saying that he may take hydroxychloroquine as a preventive measure. This is not a medically recommended practice. Do not take medicines that have not been prescribed for you.
I can do whatever. Look, I've been against OPEC all my life. Because what is it? It's an illegal, you could call it a cartel, you could call it a monopoly, there's a lot of different names for it. But it broke down very violently. Very violently. So I don't care about OPEC. I really don't. I couldn't care less about OPEC. Let me just say it. No. I think they're going to settle it. You know why? Because they're going to be destroyed. They're destroying themselves if they don't. Russia, it's a very important, and we had a very good conversation, President Putin and myself, very good. But Russia, a big part of their economic well-being is from oil. Well, oil is at a record low. Nobody's ever seen anything like it. It's actually lower than you even think. And it's to their advantage. Obviously, it's to Saudi Arabia's advantage. They told me they're discussing, Saudi Arabia went much further than that. He thinks that a deal is going to be made at 10 million barrels reduction, and maybe more than that. He actually indicated it would most likely be much more than that. So we'll see what happens. I mean, we're going to see what happens. But as far as OPEC is concerned, I mean, I was against OPEC for years and years because I thought it was very unfair to our country. The beautiful thing is we have built one of the great, one of the things we've done is created so much we produce. We're the #1 producer in the world right now. I don't like it for a different reason, because it's going to hurt a lot of jobs in our country, this price. It's going to hurt a lot of jobs. Now, with all of that being said, people are going to be paying 90 cents a gallon. Did you ever hear of that? What's that, 1952 or something? All right? So from that standpoint, but you know what? I am a big believer in our great energy business, and we're going to take care of our energy business. And if I have to do tariffs on oil coming from outside, or if I have to do something to protect our thousands and tens of thousands of energy workers and our great companies that produce all these jobs, I'll do whatever I have to do. Okay? Yeah, ma'am. Go ahead.
Yeah. You tweeted a little while ago about how sad it is for kids they don't have Little League right now. But I'm wondering if you're willing to share about your youngest son and how he's dealing with life and sheltering in place, not going to school, no sports.
Well, he's a good athlete, and he loves soccer, and he's like everyone else. I mean, everything's shut down. He's in his room. He's happy, but he's not as happy as he could be. He'd like to be playing sports, Barron. And let's see what happens. But we have to get back. We have to get back. Remember that. We have to get back, and we have to get back soon. Okay?
On the jobs reports numbers.
Do you guys ever stop? Do you want to keep going for a little while? Huh? I mean, do you ever stop? How many times you ask? And in many cases, it's the same. Actually, a lot of good questions. Go ahead. But keep going, yes?
Yes, sir.
So you're not going to blame me that I kept it going too long? People said, oh, he kept it. Every time you'll ask it, no. I mean, no, it's amazing. Tony, every hand went up. I thought we've gone through the I think every single hand went up the last time. You know what it shows you? It shows you that you love what you do. Go ahead.
It's unclear what that was about. The president seems to be criticizing the press for asking questions. I want to just stay on this hydroxychloroquine subject for a moment. The president has been making this bizarre false claim that patients with lupus who have been taking hydroxychloroquine for treatment for that are somehow immune to the coronavirus. The evidence suggests that people with lupus are at a much higher risk of contracting COVID-19 and much more likely to develop life-threatening conditions as a result of the virus, not only because they have lupus, but because of immunosuppressing drugs that they take to treat it. Even if hydroxychloroquine is proven to work, they are still at higher risk. So the president's comment that they are immune is a dangerous, false thing to suggest, and also somewhat insensitive.
Because we told everybody to go home and lock your door, essentially, right? Don't come to work. You can't come to work. Don't go outside. Don't breathe. Don't do anything. We got to open up our country. But I know that it's coming back. And in my opinion, it will come back very strong. There's a tremendous energy. There's a tremendous demand. And some good things have happened. I mean, I don't know. You know, there's one habit that, as you know, most of you, a lot of you have covered me a long time before I did this. I was never a big believer in shaking hands. But I decided if you don't shake hands, you're not going to be winning a lot of contests. Right now, I'm not sure you have to shake hands anymore. A couple of people have told me, Deborah, you told me, that if we didn't shake hands, the incidence of flu's a big deal also. And that flu might be cut down in half. Who knew that shaking hands was such a bad thing? I felt it. I mean, I always felt it. And, you know, I was never to a point where I can't shake somebody's hand. I knew people like that too, but there weren't too many of them. But when I ran for office, all of a sudden I'm shaking hundreds of hands. And if I don't, I wouldn't even be standing here. But I think that's a custom that maybe people don't have to. We have to get close together. We have to sit together at the stadiums. We have to sit next to each other and rest. All that stuff is going to happen. But I think the concept of shaking hands maybe is something that's going to be a little bit from the past. Let's see what happens. Maybe they'll go right back to shaking hands.
My last question today, how about that? Is there anything you want people to do to show their support, especially we have two doctors up there, to show their support for the medical community? Is there something that we see people clapping when nurses leave?
Well, we've seen a lot of that. You might say something that I have seen such support. I saw this morning where everyone's they're clapping for fire department, they're clapping for peace, but they are really going. These people are. You know what they're like? They're like Tony. They're like warriors, Mike. They're like warriors. They were going into Elmhurst Hospital, which has been tragic, right near where I grew up in Queens. Going in, and the people in buildings are going. I mean, they're the rock stars. They're warriors.
The president is rightly celebrating medical responders. It is important to note that he has been accusing them of theft. Several times in the past week, he has implied that New York's medical supply shortage is because the equipment is, quote, going out the back door.
Something, and Mike, you may say something about that.
Yeah, I'm glad you brought up that question, because I don't think people can really fully appreciate the extraordinary effort of these people. I mean, it's amazing. I did all of my medical training in New York City in a big, busy New York City hospital at a time when it was just what you normally see in a hospital. I came to NIH, and I spent about 5 to 8 years in the very early years of the AIDS epidemic, which was just the darkest years of my life because almost every single one of my patients died. And yet, as we knew epidemiologically, that there was very little risk. There was a small risk, but very little risk of getting infected from a patient. To see now what these brave warriors are doing in the hospitals, not only giving life-saving treatment to people, but every single day putting themselves at risk for themselves and their family, I just think that the American public owe a phenomenal debt of gratitude for these people.
How do you want them to show that?
And they should just salute them at every way you can. You know, when we were at war, and at the height of the war in Afghanistan and Iraq, when you're at an airport and you'd see somebody with a uniform come by, everybody would do that. I think that's what we should do when we see healthcare workers, just applaud them.
Pretty much what's happening. Mike, please.
The stories are incredibly moving about what healthcare workers are doing every day. It's not just that they're going back into the hospital in places like New York and New Jersey, earlier than that in Washington State and California where this first began. It's not just that they're providing care to people, but because of the nature of how contagious the coronavirus is, they're also supplementing for family. I mean, that's what gets to me. When I hear the stories that, understandably, in nursing homes and in hospitals, they're restricting visitors, and they should, to prevent the spread of the virus to be brought into the hospital or to be brought out. And so to hear the stories of healthcare workers who are holding up an iPhone while someone who's critically ill with the coronavirus may well be saying their last goodbyes to their family, and then to be there in those moments. I mean, our healthcare workers they're not just doctors and nurses today, they're supplementing for family, for people all across the country. And I just think, tomorrow's Palm Sunday. It's Holy Week in the great Christian tradition. And I have people ask me from time to time, send me an email or on the many conference calls that we have, they said, what can we be praying about? And my first thought is with the families who have lost.
It is not only Holy Week for Christians who are not the only people in the country. There are about 35% of America does not identify as Christian. Also, this is Passover, which is another Holy Week for a large segment of the population.
We are all grateful for them every hour of the day.
And think also about the Army Corps of Engineers. That's a little different, depending on where they are and where they're working. But the Army Corps of Engineers, throwing up a hospital in New York City, 2,500 beds in 3 days? I mean, think of that. And FEMA, what they're doing. And the National Guard is now delivering for the states because the states were unable to we'd drop it at a big warehouse where we're told to drop it. And the states were unable, some of the states were unable to bring it from the warehouse to the site. So we got the National Guard to become a delivery service, if you can believe it, and they would bring it. And some of those sites were dangerous sites. They were very dangerous sites. Think of that. It's been amazing. It's been amazing. I just think I've never seen anything like it. I'm so proud of this country. And really, it's a world problem, and some countries in the world are just handling it so well. You know, again, I keep saying it's 151. That was as of 2-3 days ago. It's probably more. Some people said they didn't know there were that many countries. That's how big this is. And Mike said something else. So, yeah, Palm Sunday, tomorrow. Think of it. We're not going to churches on Palm Sunday. But think of next Sunday, Easter. And I brought it up before. I said, maybe we could allow...
So just a couple of things. The president keeps saying that this disease is in 151 countries. It is in 181 countries. He's also choosing to fixate on Passover and Easter, which are very important holy days for many Americans. But there are other Americans of other faiths, Passover will be beginning this coming week, and there are millions of Americans who do not practice any faith and who are nevertheless as American and as involved in this struggle as everyone else.
Laptop as opposed. So how sad is it that we have Easter Palm and Easter Sunday, and people are watching on laptops and computers? It's sad. But the job that this whole country has done is amazing. But I'll say this, our medical professionals, what they've done, because they walk into those hospitals, you see them putting on their gear, and they're putting in orders, they're walking through the front doors. And some of those people are going to die. They're going to die.
The president is correctly recognizing that our medical professionals are putting their lives at risk, which makes it all the more striking that this past week he has been accusing them of theft.
It generally hits the older people where they have problems. It hits young people too, and it hits middle-aged people too. But these people are walking into hospitals, and I watch. I think it's incredible. And they're putting their outfit. They're getting it, and they're going in. They're going. It's like a war. Again, there's never been anything so contagious as this.
Again, that is false. There are many diseases that are more contagious than this.
Like this. Now, in 1917, had they had the internet and all the means of communication, they could have practiced distancing. You know, by the time people started thinking in those terms, they lost, I guess, 75 to 100 million people. So that's modern. You know, that's a modern day great thing that happened. Please.
Yeah, just on antibodies. To what extent do you think that you can use antibody tests to determine who can go back to work and how?
Well, I don't know. I'd rather leave that to the doctor. Doctor, do you have an answer to that?
You think it'll be a tool?
We think it'll be a tool to help us get people back to work. It'll be additional information because, as you know, if you have an antibody, that means you were exposed and have recovered from it. That, with the information about diagnosis, should help.
So the president, just a small number issue, but he said that 75 to 100 million people were killed by the 1918 flu. The CDC puts the number at closer to 50 million. The president repeatedly has said that this is the most contagious disease that has ever been seen. It's not true. Measles, smallpox, the norovirus, Zika, are all more contagious. This is a different threat, but the threat isn't based just on the factor of contagion.
Would not be enough. I wanted to ask your confidence level about the 30-day guidance and whether it'll be enough.
You know, it's tough to talk about levels of confidence, but I can tell you one thing that I feel strongly, that if we do in a very proactive way what I said in my opening comments, and people literally across the country as a baseline have that physical separation, and as we've mentioned up here, there'll be varying degrees of that depending upon whether you're in New York City or you're in a place that's less, but every place, everybody should be doing some degree of this physical separation.
Dr. Fauci is highlighting the importance of physical separation. I just want you to look at how close the president is standing to Dr. Birx.
I would be foolish to say that. But the one thing I am confident in, so let's take this to the bank, that mitigation works. So it does. We've seen it in other countries. We've seen it in our own country. And that's the reason why I keep coming up at every chance I get to plead with the American people to please take a look at those guidelines that the vice president keeps putting up with his chart, because every single one of those points has something to do with physical separation.
And mitigation does work. But again, we're not going to destroy our country. We have to get back. Because, you know, at a certain point, you'll lose more people this way through all of the problems caused than you will with what we're doing right now. What we're doing right now, I think is going to be very successful. But you know what? I don't know. We have a big decision to make at a certain point. Okay? We have a big decision to make. We went this extra period of time. But I said it from the beginning, the cure cannot be worse than the problem itself. And we cannot let that happen. We have an incredible country. We were having the greatest period in our country's history from an economic standpoint and many other ways. We cannot let this continue. So at a certain point, some hard decisions are going to have to be made. Go ahead.
Mr. President,
the president has again set up a false opposition that we have to choose between saving lives and saving the economy. The economy cannot function if there are the deaths of millions of Americans. He's also falsely said that prior to this was the greatest economy we've ever experienced, and it is not true on multiple metrics, perhaps the most important being that real wages, when adjusted for inflation, were declining for the past few years for most Americans.
Ready to move, I mean, literally, like an army. They're ready to move to any hotspot. But some of the ones that you're talking about, always a nasty question from CNN, but some of the ones, yeah, because I think that, frankly, you know, because you know what, you've asked that question about 10 times over the course of about a month. Look, we're mobilized and ready to go. We have a lot of ventilators ready to go. And if we had given them all out, we wouldn't. And you would be overstocked in many areas. What we're doing is we have a very good plan to take from some areas, even though we have the 10 or almost the 10,000, we're also taking from areas that won't be as badly hit as today we think they will be. There will be some areas hit harder than we think, and there's nothing that Deborah or Tony or any of these professionals can do about it. This thing moves in a lot of ways. But what we're going to do is we are going to have, and you look at us compared to a lot of other countries, we're in much better shape.
This is not true, that we are in much better shape than a lot of other countries. We have the highest rate of infection in the world, and while we have not yet had the highest rate of deaths, we are on a trajectory where that could happen. The president has laid out that under a rosiest best-case scenario, he is expecting more Americans to be killed by this virus than in 2 to 4 Vietnam Wars.
When you look at, and when you hear about Italy, and then you hear about France, and then you hear about, you know, what we have is we have many Italys all over. They're like countries. California is a country. New York is a country. If you look at them from the standpoint of what we're talking about, we have many like country spots. Some are hot spots, and there's nothing we're going to do about it. One of the biggest surprises is Louisiana, because it started off so good, and then all of a sudden it shot up like a rocket. But we are going to try and have ventilators wherever we possibly can. Jeff, go ahead.
Despite the Herculean effort of some of these companies to ramp up production as fast as possible, it still won't be enough.
Well, New York wanted 40,000 ventilators. Okay, 40,000. Think of what 40,000 is. It's like cars. It's a big project. It's an expensive product. I mean, some of them are $50,000 a piece. I saw one the other day, $55,000. That was before they start playing the games with supply and demand. Okay, some are very, very. You call them luxury. Some are not.
The president is suggesting that it is asking for luxury for New York to have enough ventilators to save the lives of the people who will need them. Again, the president is. New York has asked for 30,000 ventilators, and the president has repeatedly suggested that this is an unreasonable number. New York has over 113,000 cases of the coronavirus.
Like perhaps New York. You can spend $1 billion on ventilators and get 16,000 or a massive number of ventilators that they've been offered over the years. Or you can build a new bridge or road or something. I mean, I understand how that works. I'm not blaming anybody. I'm just saying a lot of the states had chances of stockpiling a lot of ventilators. They didn't do it, and I think we're doing a very good job in helping them out. Please, Jeff. And it's a very fair question.
The president says we're not blaming anyone, and then immediately proceeded to blame governors for not having collected enough ventilators. Now, this idea that it is the governors who have failed to plan for this is really striking and not based in facts. And the federal government, Trump had been warned, the intelligence community and public health experts had warned for years that the country was at risk from a pandemic and that the country would face shortages of critical medical equipment such as ventilators if a pandemic occurred. President Trump has repeatedly compared this to a war, and while it is not a perfect analogy, it is so strange and striking that he compares this to a war and then suggests that each state should be on their own to provide for themselves. That is not how the U.S. would go after any other war. The leadership has to be shown at the federal level, and he is the commander-in-chief.
Counties, Wayne and Oakland, they're all on the upside of their curve of mortality. So you know when you get to the peak, you come down the other side.
And when will that peak be?
So by the predictions that are in that healthdata.org, they're predicting in those 3 hotspots, all of them hitting together in the next 6 to 7 days.
Are you thinking tens of thousands of deaths in that period of time?
You can go to the website. It's variable. Each one of those communities is different, but you know where New York is, how much their mortality has been, and you know what we're seeing today are the people who were infected 2 or 3 weeks ago. If mitigation in New York worked, and we believe it is working, the cases are going to start to go down, but the mortality will be a lag behind that because of the comorbidities and other conditions. So that's why all of the predictions are that this next week, and I think we said this last Sunday when we talked about the charts, and it's difficult to do, and we tried to prepare the American people to understand that you have to, as much as you go up, you have to come down the other side, because coming down is a reflection of the cases that were coming in before.
Would you rather not say a number?
I'd rather not say a number, but the numbers are available if you go to the website. I mean, you can see that there's several hundreds per day in New York. And I think Governor Cuomo has talked about that increasing still into the 500, 600, 700 range a day. So, you know, that's very concerning to us. We, again, applaud the healthcare workers who are doing every single thing humanly possible to save more lives. And we are ensuring on a ventilator by ventilator, day by day, to get them there so that we can say and we can be there when they need it. Because we are supposed to be that group that comes in after all of the resources are exhausted. And we really applaud what Oregon did. And we really applaud what the governor is doing about moving between the states, between the different counties, to bring them to New York. Because that's what's needed today. A different place will be needed tomorrow.
You mentioned, just to follow up on something apparently you said yesterday, that you had some concerns about Pennsylvania, Colorado, and Washington, D.C. Could you expand on that?
We're watching them because they are starting to go on that upside of the curve. We're hoping and believing that if people mitigate strongly, the work that they did over the last 2 weeks will blunt that curve, and they won't have the same upward slope and peak that New York, New Jersey, Connecticut, and part of Rhode Island are having. So this is a very important, the next 2 weeks are extraordinarily important, and that's why I think you've heard from Dr. Fauci, from myself, from the president and the vice president, that this is the moment to do everything that you can on the presidential guidelines. This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe. And that means everybody doing the 6 feet distancing, washing your hands.
So,
And
I mean, ditto to everything that Dr. Burke said, but
again, please note, none of them are standing 6 feet apart from each other.
or really key hotspots that are still going up, it's absolutely essential that the ones that are down at that lower level that Dr. Burke showed the other day, those communities where They're still going up. We've got to make sure we don't have multiple waves of peaks. That's going to be the answer to the question of when we can start pulling back. Because if you keep having multiple peaks and different waves, that's going to make it very difficult. We put your foot on the, exactly what I said just before, and I keep repeating. Just make sure everybody does at least the minimal amount of that physical separation. Because the virus has no place to go if you're physically separated.
And one of the reasons that I keep talking about hydroxychloroquine is that
he is back on the hydroxychloroquine.
And the question that I most hate the answer to is what happens if you do have a ventilator? What are your chances? And I just hope that hydroxychloroquine wins, coupled with perhaps the Z-Pack, as we call it.
Z-Pack is an antibiotic. It cannot kill the coronavirus. There has been one study on hydroxychloroquine. One study, and that study showed nothing clinically meaningful.
So I don't want to get them there. I don't want to get them there. There's a possibility. And I say it. What do you have to lose? I'll say it again. What do you have to lose?
Okay, well, what do you have to lose by taking hydroxychloroquine without knowing its effects? For starters, a family, a couple in Arizona who thought they were following the president's advice ingested fish tank cleaner, and one of them died. There has been a run on calls for hydroxychloroquine, which has meant that patients who need it for actual conditions for which it is approved, such as lupus, have had trouble getting it.
Ventilator. Don't ask the answer because I hate it. If you have it and it's working beautifully, I don't like the answer because it's not a very high percentage. So I want to keep them out of ventilators. I want to keep them, if this drug works, it will be not a game changer because that's not a nice enough term. It will be wonderful. It'll be so beautiful. It'll be a gift from heaven if it works. Because when people go into those ventilators, you know the answers, I know the answers, and I'm glad you don't write about it. Mike, please.
Well, you've heard from the experts what our task force has heard. That it's going to be a difficult week for the American people. You will see testing increased around the country, and so cases are going to continue to rise across America. And before I give a few facts relevant to an earlier question about ventilators, let me add my voice to what the President just said and what all the physicians who've spoken has said. Even though we see the losses rising in the days ahead, do not be discouraged, because there's evidence across the country that Americans have been putting the social distancing and mitigation into practice, and it is making a difference. We are seeing it in the new cases that are being reported. Because remember, families that experience loss up to this day and in the next week have a loved one who contracted the coronavirus, in most cases more than 2 weeks ago. In many cases before social distancing and mitigation efforts were put into effect. And so we want to encourage you, believe in the President's coronavirus guidelines for America. Go to coronavirus.gov, print them off again, put them on the refrigerator, and remind yourself to put them into practice. On the subject of ventilators, if I can amplify the point the President made, our team at FEMA is doing a remarkable job working with governors, state health officials, and local hospitals, particularly focused on our priority areas. We'll refer to the New York metro area, which includes New Jersey and Connecticut. We're focused on the New Orleans metro area in Louisiana. We're focusing on Detroit. We're focusing on Chicago. These are the areas where we see the significant rise in cases. And we are surging supplies, specifically ventilators, but all personal protective equipment from FEMA to those areas. And just to give you a couple of examples, I spoke to governors in New York, New Jersey, Louisiana, Massachusetts, Michigan, and Maryland today alone. And in those cases, Governor Cuomo is actually assessing all of the available ventilators. We've sent 4,400 ventilators already to New York. As has already been referenced, they're going to receive a shipment of over 1,000 from overseas. And allow me to say, as I told her personally today, the governor of Oregon, Governor Kate Brown, her unilateral decision to send 140 ventilators because Oregon, they felt Oregon today is in a place where they could give those ventilators to New York, to me was in the very highest American tradition of loving your neighbor. And when I talked to Governor Cuomo, Mr. President, he actually told me they never asked Oregon for the ventilators.
Well, Governor Cuomo has highlighted today that he has had more success in getting ventilators from Oregon and from China than from getting them from FEMA. As has been said, New York estimates it will need between 30 to 40,000 ventilators, and Vice President Pence is trying to celebrate the fact that FEMA is providing just over 4,000. President Trump has repeatedly referred to the fact that he is holding 10,000 in reserve. Louisiana has attempted to get 14,000 ventilators. They've only been able to obtain 553, and only 150 of those came from FEMA. Illinois has requested 4,000, but has only been able to obtain 450. New Jersey requested 2,500 and has only been able to get 850. Virginia requested 350 and has not received any as a result of their request.
We're watching Boston area very closely. 100 ventilators are deploying today. I spoke to Governor Gretchen Whitmer today. Detroit is experiencing...
President Trump had urged Mike Pence not to speak to, quote, that woman, the governor of Michigan, because he had said that she was not showing enough appreciation.
As the president said, we're all working our hearts out. But what I want to say to American families and what I want to say to healthcare workers is that we are going to identify the resources, leave no stone unturned, and we are going to focus.
Well, they are not leaving no stone unturned. The president has specifically said he's holding back roughly 10,000 ventilators. He declined until just recently to invoke the Defense Production Act. He could have ordered the production of these ventilators when the CDC first alerted him to the danger of this threat on January 8th. Public health officials had been highlighting the lack of ventilators in our Federal Reserve since the beginning of his presidency. And he could still now use the Defense Production Act to require more companies to be involved in producing personal protective equipment.
Loan program that got up and running yesterday, but we're hearing from a lot of small business owners a lot of concerns about whether they will get this money.
And regarding the governor of Michigan, Michigan's governor said this morning, more people are going to get sick and more lives are going to be lost because we don't have enough testing, because we don't have enough personal protective equipment, because there aren't enough ventilators, because the national stockpile, I understand, is getting close to being depleted, and we've not even gotten close to meeting the needs of people that are already sick, and more are going to get sick. There's going to be a horrible cost.
Of dollars of loans to small business. And these are great loans. These are loans that get immediately paid off. These are loans that get businesses back. I wish you could ask a question where something's working so well. Now, maybe things won't work well, and I don't mind that kind, but where something's working so well, and you ask a question in such a negative way.
The president is complaining that the questions that are being asked are too negative. He repeatedly attacks the press, and watch how he specifically tends to attack women journalists for their tone.
Mr. Burks,
yes.
Some demographics such as seeing that men might be more susceptible to the virus, seeing in Europe more cases among the between 30 and 50 class. Has the data that you've seen in the past 2 weeks changed that assessment? Are men more susceptible?
I don't think it's changed much, has it?
Yeah, same pattern as Europe.
Same pattern, same answer that we've given you
That
for the
includes
last.
folks with between 30 and 50 being more adversely affected than what we've seen in Asia?
No, tomorrow I'll bring you all the graphs back so you can see it.
We can bring an updated graph, but it's very similar. Please.
Mr. President, a few days ago you talked about possibly restricting flights from hotspots. Where
Yeah.
are you on that? Where's your
We're looking at it very seriously. Right now, we're dealing with governors, we're dealing with airlines, we're dealing with a lot of different factors. It's a very difficult decision. We're also doing testing, getting into planes, very strong testing. States are doing testing of people that leave planes because they don't want to have people coming in who are infected. So understanding that and the level of testing has been enormous. Okay, and some states are saying you have to go in quarantine for 2 weeks if you come from certain areas.
The president is saying the amount of testing has been enormous. The U.S. is behind the rest of the world in testing. We are ranked 41st in testing per capita.
Very strong, very powerful testing. Please go ahead.
Some airlines, sir, and they say they don't know what you're talking about.
Okay, well, then you'll check up again.
One last question on ventilators.
Governments are doing it too, our government. Go ahead.
One last question on ventilators. The governor of New York said that he received donation in ventilators from Jack Ma of Alibaba, which I think is your friend. Would you call on the business community to donate ventilators, not necessarily to New York, but other states like Louisiana?
No,
Michigan?
Jack Ma is a friend of mine, and he's made it very possible to get about 1,000 ventilators from China. But that was from him and my other friend. It was really a gift, and we appreciate it very much. It was very nice of them. All right, I think we've had enough. We'll be seeing you very soon, and I'm sure that you know that all of us are going to be working very hard. We're working very hard. We are really coming up into a time that's going to be very horrendous, probably a time like we haven't seen in this country, wouldn't you say? I mean, I don't think we've seen a time like this in the country, and we're getting to that point where it's going to really be some very bad numbers. We want to keep those numbers a lot lower than they would have been, and we will do that. We have tremendous talent working. We have tremendous people, and that includes governors. That includes everybody. Everybody's working, but unfortunately, we're getting to that time when the numbers are going to peak, and it's not going to be a good-looking situation. I really believe we probably have never seen anything like these kind of numbers, maybe during the war, during a World War I or II or something. But
the numbers that President Trump is predicting that he considers a successful outcome of this amount to roughly 2 to 4 Vietnam Wars.
Of them coming, and a lot of them going to different locations, and we appreciate it very much. Thank you. Thank you.
And that concludes today's press briefing. My name is Alan Piper. I'm the senior politics producer at NowThis. I had the support today of Matt McDonough and Ian McKenna, and we are all working from home under stay-at-home orders in New York, the ground zero of the coronavirus pandemic. In this briefing today, the president called for unity. He then attacked the media. He attacked Governor Cuomo, suggesting that Governor Cuomo's calls for ventilators are politically motivated rather than motivated by the need to save the lives of the 113,000 New Yorkers who currently have this disease. He attacked Joe Biden. He attacked the Inspector General of the intelligence community and a naval commander. He then tried to brief us, tried to warm us up to the idea that we could be facing 100,000 to 240,000 American deaths. It is important to keep in mind that the death toll we are expecting was not something that was unavoidable. South Korea had its first case of the coronavirus on the same day that the U.S. did and immediately took widespread preventive action, whereas the U.S. waited 2 months before declaring it an emergency. South Korea has had only 177 deaths as compared to the over 8,200 U.S. deaths. Now, the U.S. has a greater population, so you would expect the death rate to be perhaps 10 times that of South Korea, but based on the numbers that the president is suggesting, we are anticipating having roughly 1,000 times the death rate of South Korea. So these are discouraging times, and it is natural that we are all discouraged and frightened at this time. During the course of this press briefing, the total number of global cases has gone up by roughly 20,000 in just the time that we've been streaming the president's briefing. It is important to remember that there have been over 245,000 recoveries in the world. Most of us who get this disease will recover from it. Last week, on a personal note, I shared that my wife was showing symptoms of the disease. She appears to be recovering. I received notes from many of you which have touched us and warmed our hearts. She no longer has a fever. She still has a cough. But due to a lack of testing, we may never know if what she had was the coronavirus, but she is recovering from whatever she had. But we are very glad that we did not leave New York at the beginning of this when we were contemplating it and go to be with one of my parents, particularly my mother who lives alone. My mother and my father are both in their 70s, and we could have unknowingly brought this to them. And so it is important to remember that most of us will be okay, but that we need to take these preventive measures to make sure that those who are at the greatest risk remain safe from this disease. That we need to make sure that none of us accidentally spread this to someone who will be killed by it. Here in New York, it is encouraging to see how New Yorkers' spirits have stayed high, how New Yorkers every night at 7 p.m. have been celebrating our heroic medical professionals, reaching out their windows to cheer and applaud them. Here at NowThis, we will continue to do our part by trying to bring you the best possible information, the factual information. We will get through this together. Please stay safe. Please keep your family safe. Please let your loved ones know how much you love them. If the president gives a briefing tomorrow, we will be back again to fact check it. And I hope that you have a very good night. Thank you from all of us.